Kathryn and Barry Wilson remember the daughter they no longer have. Rebecca spent 5 years in mental health hospitals before taking her own life when she was 18. An inquest into her death found that poor monitoring by her hospital gave her the opportunity to kill herself. Poor planning in transferring her from adolescent to adult psychiatric care also worsened Rebecca's problems.
She went from having everything as what a teenager, a child would have, and then the day after she's expected to be an adult and fit in with a lot of older women, with a lot of bad health problems, with none of the teenage things around her.
Today's report finds that over 650 people with mental health problems kill themselves in prisons, police cells or psychiatric hospitals between 2010 and 2013. Researchers say the overwhelming majority of those suicides could have been prevented if the same basic errors hadn't been committed and repeated. Hospitals having places where patients can hang themselves, prisons failing to act on prisoners' known psychiatric problems.
Too many of the deaths we've seen are caused by the same sorts of mistakes being made over and over. That arises partly because when there is a death and there isn't a proper robust investigation about what happened, there isn't a real level of transparency and openness about what's going on in institutions.
The Commission says independent investigations of deaths in psychiatric hospitals should be introduced as a matter of urgency. Ministers say they're aiming to improve how hospital deaths are scrutinised and how high-risk prisoners are cared for. Buchanan, BBC News.